Hi, welcome back. Today we're covering the heart and many of the major blood vessels found in the human body. So, looking at just the heart, we're going to start with just a general overview of what the heart is and the different anatomical features on the heart. Then we're going to get into the circulation that the heart participates in. So, what blood vessels are coming off the heart, what blood vessels are coming into the heart, and then what are the blood vessels that actually give blood to the heart that consist of the coronary circulation. Then we're going to look at major arteries and veins found in the human body. So to begin with, the heart is about 1 pound. It's roughly the size of a person's fist. It's found in this thoracic region. So it's sitting in this region called the mediastinum. This is anterior to our thoracic vertebrae, posterior to ribs, sitting on top of the diaphragm. So this is the muscle that will be contracting and pulling the lungs down. And then the mediastinum is going to be inferior to the clavicle. So it's found in the area where the lungs are found. The heart itself is kind of a triangle shaped structure. So at the very top of it, we have the base. So this is where the aorta is coming out of. And then at the very tip of it, we have the structure, we would call it the apex. So that's where the two ventricles are coming together. So if we look at the layers that are holding the heart in place and protecting it, we want to start with the pericardium. So the pericardium is this double-walled sac that's enclosing the heart. It's very convenient if you think of if you were to push your fist into a balloon. This would create two layers, a layer that's in direct contact with your fist and a layer that's not in direct contact with your fist, and then a space in between those two layers. For the heart, the layer that is in direct contact with the heart is called the visceral pericardium. The layer that's not in direct contact with the heart is the parietal pericardium. And then the space in between those two layers is called the pericardial cavity. So this cavity will have liquid, about 15 to 50 milliliters of liquid that will reduce friction whenever the heart is pumping and keep the heart protected. So down here we can see those layers. So this would be myocardium, so actual heart tissue. The layer that is in direct contact with that myocardium will be the visceral pericardium, and then the thick layer that's on the outside that is actually going to attach the heart to abdominal and thoracic structures will be the parietal pericardium. So we have parietal on the outside, visceral on the inside. Okay, looking at the layers of the heart themselves, there are three different layers. So starting with the endocardium, this is the layer that will be lining the chambers of the heart. This is what blood in the heart will be in direct contact with. So endocardium is on the inside. Then the myocardium, this is going to be the muscular layer of heart. So this is what is responsible for producing the contractions every heartbeat. So myocardium, think muscle. And then the final layer is the epicardium. This is the outermost layer, and this is also a layer of visceral pericardium. So on the previous slide, I showed we have myocardium right here, and then visceral pericardium. That visceral pericardium will also be classified as the epicardium. So we really have two names for this one structure. We now want to look at the basic anatomy of the heart, and then we now want to look at the basic anatomy of the heart and look at how blood is flowing through the heart. So here would be our simplified model, our simplified diagram of a heart. So it has four chambers. There is a right atrium and a left atrium, and a right ventricle and a left ventricle. The right atrium will be receiving blood from the vena cava. You'll notice that this is blue blood. The blue blood represents deoxygenated blood, so that means our tissue has used up most of the oxygen in the blood that deoxygenated blood is being returned to the heart, so the heart can send some of that blood to the lungs so that they can oxygenate it. So the vena cava is going to be entering into our right atrium. The blood will flow through this tricuspid valve into the right ventricle, and then the right ventricle will be pumping blood to the lungs. So it's still our blue blood deoxygenated, so we need to send it to the lungs to become oxygenated, and it's going to be leaving through our pulmonary artery. So this is the first confusion that I want to flag. A lot of people think that arteries are arteries if they have red blood. This is not the case. We'd rather stick to this definition down here. Arteries carry blood away from the heart, and veins carry blood to the heart. So this is independent of the oxygenation status of the blood in the heart. So arteries are going to be leaving the heart, taking blood away from the heart, and then veins will be returning blood to the heart. So we say that the blood pumped out of the right ventricle will pass through the pulmonary artery to the lungs. So it's going to the lungs, away from the heart. Once that blood becomes oxygenated in the lungs, we now have this red color, and the vein that is returning that blood to our heart is called the pulmonary vein. So again, people generally think veins are blue. Here we have a red vein, or it has red blood in the vein. So we have reoxygenated blood, or oxygenated blood, returning to our left atrium. The left atrium will then pump that blood through the mitral valve or the bicuspid valve. It has multiple names, down to the left ventricle. And then the left ventricle is the chamber of the heart that is responsible for pumping blood to the rest of the body. So that blood will leave through an artery, and that artery is called the aorta. So if we look at how it looks in the human body, so this is what our heart looks like compared to our simplified model over here. But we still have our two atriums, so a right atrium and a left atrium, and then a right ventricle and left ventricle. So if we start down here in the body, this is showing that oxygenated blood is coming into tissue of the body. That tissue will then use up the oxygen, and the blood will become deoxygenated, and that blood needs to go back to the heart so that it can eventually get pumped to the lungs to become oxygenated. So that blood will return to the heart through the vena cava. So we'll have a superior and inferior vena cava that feed into the right atrium. The right atrium will pump blood down to the right ventricle. Then the right ventricle will pump the deoxygenated blood through the pulmonary artery, because it's going away from the heart, to the lungs. The lungs are where we have alveoli that allow oxygen to diffuse from air into the liquid of our blood, and then ultimately reach our red blood cells so that we have oxygenated blood. That oxygenated blood will then leave the lungs, return to the heart through a pulmonary vein, enter into our left atrium, be pumped down to the left ventricle, and then the left ventricle will pump the blood out through the aorta, allowing the rest of the body to have oxygenated blood once again. So if we take off a piece of the heart, we can see where we have our superior and inferior vena cava dumping blood into our right atrium. It's showing that our right atrium has this specific type of muscle inside of it. So this is what will be contracting whenever the heart pumps blood from the atrium to the ventricle. So the muscle in the atrium is called pectinate muscle. Meanwhile, the muscle in the ventricles, which have to be much thicker because they're pumping blood to a destination that's further away, this blood, or these muscles, will be called trabeculi carni. Then if we look at down on our right ventricle, that's going to pump blood through initially the pulmonary trunk and then the pulmonary arteries. So you'll have a left and right pulmonary artery. And then we have our pulmonary veins in the back that will return blood to our left ventricle, and then we have the aorta, that will return it to the left atrium. Then blood gets pumped down to the left ventricle, and then eventually out through our aorta. Okay, so that is all what it looks like in a human adult heart. We also want to emphasize a few structures that are the result of fetal development. So here we have two structures. I'm going to show another slide that will have the adult structures, but first let's look at the fetal structures. So if you think of a fetus, it's really submerged underwater. There's no gas to be inhaled or exhaled. It's receiving its oxygenated blood from the placenta, from the mother. So the blood that is entering our fetal heart is actually oxygenated already. So unlike an adult, where they have deoxygenated blood entering into the heart, for the fetus, there is oxygenated blood entering the heart because the mother has already oxygenated the blood. So that allows the fetus to bypass the pulmonary system. Some blood still needs to go to the lungs because they themselves need oxygen, but the lungs in a fetus aren't providing the oxygen. So there's a structure that is literally a hole between the two atrium that allows the oxygenated blood from the right atrium to pass to the left atrium. And this is called the foramen ovale. So we already had a foramen ovale on the sphenoid bone. So that was the oval-shaped bone that we looked at for nerves to pass through. But here we have another foramen ovale, and this is simply a hole that will allow blood to go straight over to our left atrium and then eventually down to the left ventricle and then out through the aorta. The other structure is called the ductus arteriosum. So that is a pathway from the pulmonary artery directly into the aorta. So this is allowing the fetus to again bypass the pulmonary system. Instead of sending this blood to the lungs, it can be immediately introduced to the aorta and then to systemic circulation. So those are the structures that are found in the fetal heart. If we look at those remnants in the adult heart, so then we have the ligamentum arteriosum. So this is the remnant of the ductus arteriosus. So this used to be a pathway that allowed blood to pass from the pulmonary trunk into the aorta. But in adults, it's just a thin connective tissue. And then for adults, the foramen ovale becomes this sheet of tissue called the fossa ovalis. So this will prevent blood from going from the right atrium to the left atrium. And then valves are a critical component of heart function. So there are 4 valves that we want you to be able to identify and understand when they will be open and when they will be closed. So there are 2 classes of valves. There are these atrioventricular valves, AV valves. There is the tricuspid valve that separates the right atrium from the right ventricle. And then there is the bicuspid valve, or the left AV valve, or the mitral valve, all refer to the same structure. This is separating the left atrium from the left ventricle. And these valves come with these additional structures. They have these chordae tendineae, these tendinous cords coming off of them that are attached to papillary muscles. So these muscles will be contracting at the same time whenever the ventricles are contracting, and this will hold down these AV valves. So the ventricles are very strong. They're pushing blood out of the ventricles, and they want it to either go through the pulmonary trunk or the aorta. They don't want the blood to flow back to the atrium. So these chordae tendineae and papillary muscles are working to really hold the valve closed tight whenever that pressure is occurring. The other class of heart valves are the semilunar valves. So these are the gateway into the pulmonary system and the systemic arterial circulation. So the pulmonary valve is at the base of the pulmonary trunk, and then the aortic semilunar valve will be at the base of the aorta. We now want to look at a few more structures found on the outside of the heart, and then start to look at the individual coronary arteries and veins that are responsible for providing the myocardium with oxygen. So starting with the heart, there are these flaps on the outside of the atrium. These are called auricles. These are allowing the atrium to expand. So those are just found on the atrium. Right below the atrium, separating the atrium from the ventricles, is this smooth, or this depression called the coronary sulcus. And as we'll see on the next slide, this is where our right coronary artery will be found. But there's this depression that is going to be separating our atrium from ventricles. Then there is a depression kind of separating the right atrium or right ventricle from left ventricle. It's not a precise separation, but this is where our major blood vessel going down the front of the heart will be found, both the major artery and major vein. So this is called the anterior interventricular sulcus. And this is where our anterior interventricular artery will be found, along with the great cardiac vein. So anterior interventricular artery and the great cardiac vein. In the posterior side of the heart, there's going to be an analogous sulcus and artery. So these will be the posterior interventricular artery and sitting in the posterior interventricular sulcus. Then if we look at the aorta, so immediately as the aorta comes up, it's going to become an arch. It will branch because most of the blood it needs to send to will be inferior to the heart. But there are these three major blood vessels coming off the aorta at the top of the arch. There is a left subclavian, so this will supply blood to the left upper extremity, the left common carotid, supplying blood to the left side of the brain. And then on the right side, there is a brachiocephalic trunk, and this trunk will then give rise to the analogous structures on the right side, the right coronary artery and the right subclavian artery. If we look at just the coronary arteries and veins, again, these are responsible for providing oxygen to heart tissue, and this is what will become blocked whenever one has a heart attack. So if we look at the left side, this is showing all the arteries that you need to know, the ones that are boxed. And then on the right image over here, it's showing all of the venous structures you need to know. So one thing I want to highlight before we get into the individual arteries is that this is showing both an anterior and posterior view. So this is kind of like a transparent image where the darker color represents an anterior structure, and then you'll notice that this right coronary artery is going to wrap around and become more faint. So these are on the posterior side of the heart. So we're looking at anterior views in both of these images, but we can also see posterior structures. So if we look at the first two components of the coronary circulation, these are branching off the aorta. So remember that the aorta will have oxygenated blood. So we'll have the right and left coronary arteries coming off the aorta. The right coronary artery will give rise to two more arteries. One will be the right marginal artery. This will supply blood to the right ventricle. And then that coronary artery will wrap around and give rise to the posterior interventricular artery. So that will be going down the back side of the heart. the left coronary artery is also coming off the aorta, and that gives rise to the anterior interventricular artery. So that's the major artery running down the front of the heart. And then the circumflex artery, which will start to wrap around the heart and give rise to additional arteries, but you will not be held responsible for knowing those. So then, as the blood becomes deoxygenated, it needs to be returned to the right atrium so that it can re-enter circulation and become oxygenated. So there is the major vein running down the anterior side of the heart. This is the great cardiac vein that will be running side by side with the anterior interventricular artery. There is the small cardiac vein. This will be running right down the side where the right marginal artery is found. And then there is the middle cardiac vein running right along the posterior interventricular artery. These veins are all collecting and ending at this structure called the coronary sinus, which is then going to drain blood into the right atrium. If we look a little bit more in detail at the brachiocephalic artery, you'll notice that it's again giving rise to the same structures that are found on the left, but we just have to have this additional brachiocephalic region. So the left side that's branching off the aortic arch will be our left subclavian artery and left common carotid. And then on the right side, we have our brachiocephalic artery, which will give rise to those two blood vessels as well. So you can see how those blood vessels coming off our brachiocephalic trunk right here will give rise to blood vessels going up to the brain and the skull, and then blood vessels that will be running down the upper extremities. Here are the major arteries and veins that you need to be able to identify on the human body. So I've starred the ones that are on the terms list. So there are a few that look very similar to nerves that we've already covered. So there will be our axillary artery found in the armpit region right around the axillary nerve. The subclavian arteries, which again are coming indirectly or directly off the aorta. These give rise to several more arteries going down the upper extremity. There's going to be two types of, well, first there will be a common carotid artery that will give rise to two types of additional carotid arteries, an internal and external. So external will be closer to the skin, internal will be deeper. We have the brachiocephalic vein. So this is going to be found where the brachiocephalic artery is. Then we have, after the aortic arch, we're going to have a thoracic and abdominal region. So those are described here. Thoracic aorta is above the diaphragm, and the abdominal aorta is below the diaphragm. So that would be kind of right in this region right here. We have several of these arteries are going to be paired. So you'll have a right and left subclavian, a right and left common carotid artery. After the abdominal artery, we can trace the blood flow once it gets down to the pelvic region. The aorta is going to branch into either a right or left common iliac artery. So those would be right in here. Those common iliac arteries will give rise to an internal and external iliac artery. The internal running on the inside, the external running on the outside. And then these arteries have analogous veins. So there's going to be an internal and external iliac vein. So external here, internal here, and then a common iliac vein. And then if we kept tracing down a external iliac artery, that will give rise to the femoral artery, which will be our major blood vessel in the thigh. And then a couple final arteries that aren't really paired. They're just individual arteries that are coming off the aorta. So first we have the celiac trunk. This is going to be the first artery after the diaphragm, so the first artery coming off our abdominal aorta. And this is going to branch into three different blood vessels that will ultimately be supplying blood to the liver, the small intestine, stomach, and pancreas. And then right below the celiac trunk, we'll have a right and left renal artery, which will be supplying blood to the kidneys. Vein-wise, we already covered these iliac veins, very similar to the iliac arteries. We have the internal iliac vein, the external iliac vein. Those two will fuse together to form a common iliac vein. We'll have a superior and inferior vena cava. And then finally, we have this vein called the hepatic portal vein. So any vein that is a portal vein is going to be connecting two capillary beds to one another. So most of the time, veins will just leave one capillary bed and ultimately return blood to the heart. But because we want to filter the blood that gets obtained from the digestive system, there needs to be this portal system that will take blood from the digestive system directly to the liver. So it's a venous structure, but it's not taking blood directly back to the heart. And then after the liver detoxifies any potential toxins, then the blood will end up back in the vena cava and then enter into the heart.